I will begin with Her Excellency, or I would like to call upon Her Excellency, Ms. غادة والي, the Minister of Social Solidarity in Egypt, to speak to us first. She has a very long and distinguished CV, which I will not read in its entirety because it would be extremely challenging to do so. She's the coordinator of the Interministerial Committee for Social Justice, and she chairs the Executive Council of Arab Ministers of Social Affairs in the League of Arab States. And her work experience includes 27 years in the field of poverty reduction and social protection, including in the role of being chairperson of Nasser Social Bank, a pro-poor development finance institution. And I've already noted the importance of finance in what concerns us today. But also with respect to various social organizations and involvements which have significance from the point of view of equality, such as the National Center, being chair of the board of the National Center for Social and Criminology Research, National Fund for Drug and Addiction Control, and the National Authority of Social Insurance, which serves 25 million Egyptians, among many others. Many other distinguished achievements. So let me pause there and call upon her to please address us. Thank you.
Thank you, Mr. Chair. It's indeed an honor and a pleasure to be here today and to try and build on what we have heard this morning. Some very important thoughts were shared in the morning session, and I hope that what I will be sharing with you in terms of what we are doing in Egypt will be of relevance. And I would like to commend the reference to Jean-Jacques Rousseau and his discourse on inequality, which is indeed very relevant to the stuff that we have been discussing and debating this morning. I will share with you very quickly what we have been trying to do on the path to inclusion and social protection and reaching social justice in Egypt. I have prepared a presentation which I hope will help demonstrate the work that we have been doing. The Social Justice Committee has been working on a number of axes: social protection, improving targeting, improving the access to education and health, and we have heard this morning the importance of education and health for inclusion, and improving also nutrition. We have been looking at the targeting and what Egypt has been doing for years without the proper targeting, and trying to improve targeting for equity and for sustainability. So we have changed our programs of subsidy from non-conditional to conditional cash transfers. We have moved from looking at income poverty alone to multidimensional poverty. And we have heard this morning the importance of technology and automation and data. We have moved from a non-automated manual system that is completely dependent on social workers in villages to a fully automated and timely system. Permanent cash transfers were availed to people regardless of the change of the situation. We have moved to a system whereby the targeting is reviewed, an assessment is made every 3 years for each and every household. We have expanded the coverage to include the poorest areas, with a focus on geographical areas and remote areas that have traditionally been away from development, because the story of Egypt is a story of disparities, regional disparities, gender disparities, and it's very important when we speak about vulnerability and inclusion to look at those differences at the micro level and not to look at averages. Poverty maps have guided us, and we have used in the design of a program that was based on the experiences of Latin America, what we have learned from Bolsa Familia in Brazil, Oportunidades in Mexico, Chile Solidario, and other countries in Indonesia, in India, in other parts of the world, because we believe that learning from best practices is very important. An integrated social safety net is what we have been trying to do. So we have worked on developing social insurance, and we have issued a social insurance law that is a universal social insurance law, and we are working on improving access of health care, Cash transfers is the program that I'm going to discuss in details and where my ministry is responsible for its implementation. We have also launched a school feeding program. We have continued to expand the food ration card. Decent housing is a central and important program in our interventions. We have also worked on improving the social pensions and insurance law and a public works program that is labor intensive, that avails employment, and improving the infrastructure and access to basic services in terms of water, sanitation, housing, roofing in slum and development areas. So the work that we have been doing has been focusing on social transfers, cash transfers in 5,630 villages, which covers all 27 governorates. But we have worked on the geographical areas that are poorest. So we have asked everyone to apply, and we have used these applications to build the largest and most updated database in the country, because we believe that information is very important, data is very important, and we have now at the ministry the largest data bank with 27 million individuals with the details of their lives, their education, their health situation, their income, their house, their connectivity to infrastructure and to basic services. It's all there in our database. Not all of them get a cash transfer, but all of them are in the database, and we use targeting to provide to different people different services. This is the growth of the program, which has become one of the fastest growing cash transfers program globally. We have unified the different cash transfers program that we have in the country to have one solid cash transfer program that is based on solid and updated data. If you look at the distribution of the target of the cash transfer, you will see that we are very biased to Upper Egypt. 71% of the funding goes to Upper Egypt because this is where poverty is. Although we have 25% of the population living in Upper Egypt, 67% of the poor live in Upper Egypt. So we have focused on Upper Egypt, then Lower Egypt, the Delta region, then Cairo and Canal governorates where poverty is less prevalent. So here the geographical disparity has been addressed. Gender and social protection. We have heard this morning the importance of gender inclusion. 88% of card holders are women. Healthcare is provided for women who are in this program. Reproductive health care. We have also heard the story of early marriages, of FGM. All this is addressed in a program that is called Two Are Enough, whereby we provide women with the different choices for reproductive health, with awareness about what their rights in terms of marriage, of divorce, of being in control of their family planning decisions. We provide loans for women to start their micro enterprises if they have left school and they want to start their micro enterprises. Financial inclusion is very important, and one of the very side benefits of this program is that for women to apply to this program, they had to have all their IDs and papers in place. So this program has helped 650,000 women to get their IDs and gain access and control of all their papers in terms of birth certificate, marriage certificate, and national IDs. We are building nurseries and upgrading the nurseries all around the country to provide services to take care of children, so that women are allowed more time and allowed the opportunity to access the job market and the labor market. The functional assessment for disability is very important. This morning also the word disability was mentioned a number of times. We have designed a program for the disabled. For the first time, we are building a database to capture all types of disabilities. Where are the disabled? What types of disabilities? And how to include them in the labor market, how to provide them with the kind of support that is targeted, that is designed for their type of disability, and to allow them to become part of the labor force, which is very important for their dignity and for their contribution. So we have been training doctors and automating the healthcare units and linking them to our database and allowing them different tools with a lot of support from the World Bank on this axis to really define disability, identify their ability to work and to access work, and provide them with the proper training needed and with cash transfers if they cannot work. Automation has been very important. What we have achieved achieved in 3 years is more in terms of numbers, geographical coverage, and depth than what Egypt has achieved in 30 years. And actually, this is because we have used 20,000 social workers and we have automated the whole system vertically and horizontally. We have been linking with 11 different ministries, and we have been linking in the 27 governorates, the 340 administrations, and working on the automation of 2,600 social units. Grievances and case management has become a very important element in our targeting, and social accountability is very important. And here I refer to what has been said this morning on governance, on transparency, and on fighting corruption. In villages, communities are asked to review what we do. We post on the walls of the social units the names of all those getting services, and we ask the community to come forward and to tell us if these social services are not well targeted, if we have left someone behind. Our motto is leave no one behind. So if the community feels that someone who deserves is left behind, or there is an inclusion error where we have included people who do not deserve the support, they are asked to come forward. And we have trained committees in all villages to monitor our work, to develop the knowledge and the know-how to access the social unit and to inform us in a central manner, in a central database, and in the social unit level on how are we doing in terms of targeting. This is a schematic overview of the complexity of the database and the MIS system, from application to registration to field verification to internal validation to the PMT, the proxy means testing and application, and the external validation. And then there are the inquiries, the conditionality, and the cash transfer. There is a debate globally around the importance of conditionality. Is it worth it? In our country, we think it is, because 62% of the population among which we work, among the very poor women in villages, is still illiterate. So it's an incentive for families to put their children in school. This is the map. The red and the darker colors are where the poorest governorates are. This is how the money is distributed and the numbers of beneficiaries. And again, 72% of the cash transfers are provided to Upper Egypt, where the poor are. Again, looking at who is not sharing the gains and addressing them, finding them and reaching out for them, and why they are not sharing the gains. They are not sharing the gains because of lack of education, poor health, and lack of information and lack of opportunities. So this is how we are using this program to enforce the conditionality and invest in human development. So what we have been doing is work with the Ministry of Health and work with the Ministry of Education, training social and community workers, and the program has helped to create thousands and thousands of jobs for community workers and for youth in the villages to reach the beneficiaries. The grievances and the inquiries, we think, are a very important tool for each and every beneficiary to feel empowered, to feel that they have the right to complain and to approach authorities and to complain and to inquire about why they're getting the services or not getting the services. Social accountability committees, I have mentioned them, and they are a new model, and a model that we are very proud of, because we have 2,226 social accountability committees in 24 governorates, and these are based on a decree, so they have a sort of a semi-official role whereby they hold government accountable. This is the governor. This is one of the photos taken in Kena governorate, where the governor is explaining the program to the people who have volunteered to join the social accountability committee, explaining to them the role and the importance of their engagement. The impact evaluations have been implemented by IFPRI and have shown very positive results when it comes to economic conditions. The poor have been able to save more. They have been able to create for themselves income opportunities, specifically for women. They have used the cash to repay debts, to pay late bills, to fulfill the child education needs, food purchases, and they have been receiving and feeding their children more proteins, more vegetables, more fish, more meat, and more poultry. We have been looking at the impact on education. 100% of the children of this program are enrolled in education at different grades. Households have reported that they used part of the money to cover the education-related expenses, and they have been spending more money on tutoring, on providing their kids with what is needed to go to school. The beneficiary satisfaction has reached 68% and more. And we have complemented this with a number of programs. The first 1,000 days in the lives of a child, this is about early marriages and feeding pregnant women and supporting malnutrition in Upper Egypt. 2 Are Enough is a program about reproductive health care and again empowering women by having control over their birth and delivery and having children decision. No Literacy with Takaful is a program whereby we are helping women who are illiterate get a level of education that helps them to follow up with the schools. And decent housing, we believe, is very important to improve roofing, access to water and sanitation for better health. A very important intervention is micro-enterprise. Microloans are very, very important for women to have their own income, to be economically independent and to feel empowered and become the center of the family because they are a source of income to the family. The number of projects that we have developed is in this pie, and these are a number of different projects. Some are in agribusinesses, some are in small trade, some are in small productive cottage industry, cultural and handicrafts and artisanal, but they are all about giving women a loan and helping them save and helping them access an opportunity for income generation. We are moving people and assessing them after 3 years in the program to find an opportunity to work, be it through a micro-enterprise or join a formal employment or get some vocational training to improve their condition. At large, we think that this program needs to continue review its targeting policy. The data is a very important tool now for different ministries, and it is available for different ministries so that they can design programs that help include the poor. For us, leaving no one behind is a commitment that the government has presented to Parliament. We have been working on mobilizing the resources. However, we still believe that the issue of financing development and the issue of financing inclusion and the issue of looking for the fiscal space that is needed to create the jobs and to create the equal opportunities is still a challenge in our part of the world. Thank you very much for availing this opportunity, and thank you very much for having this full day of debates around this very important topic. Thank you.